Good morning. Hello. My name is Farhan. So today I will presenting about the heat-related illness. Okay. By definition, heat-related illness is mean the serious medical condition resulting from the body's inability to cope with the particular heat load. So this is the diagram. We can say the pathophysiology, the physiology of the heat illness. I mean the heat transfer to the surrounding environment. So basically, we have a four process or four method of the heat transfer, which is the first is conduction. Conduction is mean the contact from our skin to the object, the other object. So they mean we transfer the heat to the other object by the direct contact. The second one is a convection. Convection is mean heat transfer or heat loss via the fluid or gases. That mean when our body is produce the sweat, so the sweat will be become the process of the one of the convection when it become evaporized to the air. So the second one is radiation. Radiation is involving the infrared rays between the infrared rays. So our heat transfer beyond by that medium. The fourth one is the evaporation. Evaporation is the we mean the gases or fluids directly transform to the gaseous particle. Okay, so this is 1, 2, 3, 4. Convection, conduction, radiation, and also evaporation. The pathophysiology or the physiology of the mechanism control thermal body is controlled by our body. We call as a thermostat. Thermostat, which is controlled in the preoptic anterior hypothalamus in our brain. So when the body internal temperature inside the body is increased, it will send a signal to the hypothalamus, and then via the sympathetic nervous system, it will give a signal to the effectors organ, such as the blood vessel and also the sweat glands. For the blood vessel, there will be vasodilate. So when the vasodilate, they will transfer more the heat from the blood to the skin and then skin to the air. For the sweat glands will become active and then increasing evaporative heat loss. So that will reduce the body temperature. If our body temperature decrease, so same pathway also, they will send the signal to the preoptic anterior hypothalamus. So from the hypothalamus, they will send a signal to the effectors organ through the blood capillaries and also the skeletal muscle. For the blood capillary will vasoconstriction and then will restrain the heat from losses from our body. For the skeletal muscle will be shivering. So when the shivering mechanism is occur, they will increase the metabolism and so generate the heat. So they will maintain the temperature inside the body. So what is the risk factor of the heat illness? Can be divided to two, which is extrinsic and intrinsic. Extrinsic means from the surrounding environment, such as the temperature, the humidity, air movement, from the physical activity, intensity or duration itself, and then also for the clothing material and also the PPE. While the intrinsic is the physical condition of the individual, the age, ranges of the age, water consumption, medication, and also alcohol or drugs. So where is the most accurate part we can measure for our body temperature? The most accurate part is at the rectal. So the rectal is the core. They will consider as a core place to measure the temperature. Other than that, we can also use ear, which is the more easier. But the ear will be have a slightly different compared to the rectal, which is about 0.5 to 1. Okay. So heat illness can be divided into two categories, which is minor and major. Minor can be divided again for the four, which is heat edema, heat syncope, heat cramps, and heat exhaustion. One more is heat tetany, while the major is heat stroke. So for this slide, I will be more focused about the heat stroke management lah. Okay. Okay. So this is the summary of the related illness for the minor category, which is the first one is heat edema. Heat edema is occur because of the accumulation of the fluid at the periphery part. It will cause the mild swelling feet, ankle, and also the hands. So this heat edema usually it will resolve spontaneously lah, by the conservative treatment such as the elevate the leg, use the compressive stocking, and also but diuretics is not recommended. So for the prickly heat, the clinical manifestation usually people will say they will have the pruritic or maculopapular rash around the body lah. But this is considered is not danger, which is can be treated by medication or conservative. We can also prescribe the antihistamine for the patient, and then try to avoid. We mean to wear or to use the clean clothes, light and also loose. Okay, for the heat cramps is the clinical manifestation usually a bit moderate compared to the heat edema and also prickly heat. Patient or individual usually will complain of painful, having an involuntary muscle and also spasmodic contraction muscle of the skeletal muscle. Usually it will involving at the calf, thigh, and also the shoulder. For the management of the heat cramps, we can either use the fluid replacement, either from the oral or IV, and also ask the patient to rest in the cool environment. For the heat tetany, is a manifestation is maybe hyperventilation. Also can be paresthesia of the extremities and circumference, and also associated also can be the carpopedal spasm. For the heat syncope is usually is caused by the pooling of the blood when at the lower part of the body because of the prolonged standing, usually prolonged standing or sitting. So it will produce or will cause the postural hypotension. This problem can be ruled out. This is rule out other causes of the syncope, and then the treatment is just to ask the patient rest and then remove from the hot environment and give the water supplement. So for the heat exhaustion is quite similar to the heat stroke, but the difference between the heat exhaustion and the heat stroke is only the CNS dysfunction. Heat exhaustion, no CNS involvement. Heat stroke have a CNS involvement. So for the heat stroke, symptom-wise, patient we have a headache, nausea, vomiting, dizziness, and also the muscle cramping. And then temperature also can be more or equal to the 40 degrees Celsius. The treatment is same thing, remove from the heat stress area, and then give the water replacement, and then check the vital sign, everything, and then usually patient will recover. Okay, so heat stroke, this is the major category of the heat related illness. What is the heat stroke definition? It can be defined as a core temperature more than 40.5 degrees Celsius with the central nervous system dysfunction. So heat stroke itself can be divided into two categories, which is the classical heat stroke and also the exertional heat stroke. Classical heat stroke is occur usually at the population in the elderly, young, and also those having the comorbidities. So without involving any strenuous physical activity. That means if we put the old age, the elderly or young people at the place open with the hot sun, they will become having a classical heat stroke. So while the exertional heat stroke is usually involving the healthy young individuals with exertion or having the strenuous physical activity. Okay, so this exertional heat stroke is the common condition in our Malaysia. So for the clinical manifestation heat stroke, patient can have a tiredness, headache, nausea, vomiting, dizziness, and also severe sweating. With the CNS dysfunction such as the confusion, delirium, ataxia, seizures, and coma. For the lab clinical findings, can be also anhidrosis, coagulopathy, and multiple organ failure. But these two, when having a patient having experience with these two, usually there's a poor prognosis. Okay. Other differential diagnosis we can do for the hyperthermia and also CNS dysfunction is either we can differentiate with CNS injury, hyperthyroid syndrome, infection or septicemia, or pheochromocytoma. For the extrinsic factors is anticholinergic poisoning, drug ingestion, or heat exhaustion. Okay, so for the workup, for the heat stroke, it's not specific diagnostic for no diagnostic test for the heat stroke. Usually we do the workup to see whether the the end organ damage secondary to metabolic derangement is happen or not. Okay, so for the laboratory wise, we can send for the arterial blood gas to see whether they have a hypoxemia or metabolic acidosis. We can send for the blood sugar to see whether the patient experience hypoglycemia or hyperglycemia. Other than that, we can send also for the electrolyte to see how the sodium, potassium, calcium, LFT to see whether the transaminase is increased due to the centrilobar necrosis of the liver. So for coagulation study, this we can send for look either the process of the denaturation protein exhibit the dysfunctional enzymes. And then for the full blood count, we can see from this set is total white is increased because of the infection of thrombocytopenia or the platelet aggregation and reduce the clotting factor. Renal function test to see the acute kidney injury. Muscle enzyme we can send for the creatinine kinase, and then also the urine analysis. Okay, so ECG usually patient with heat stroke we have arrhythmia, then we can detect from the ECG. So other than that, the chest X-ray we can do, but this one can detect for the presence of atelectasis, pneumonia, pulmonary infarction, or pulmonary edema. Okay, for the CT scan we can do for rule out any other causes such as the intracranial bleeding. Okay, so generally for the management of the heat stroke is to detect the clinical syndrome of heat exhaustion or heat stroke, and then initiate the effective cooling measure immediately, and then further prevent further metabolic derangement due to the thermal injury. So for the cooling rate, we can say we can do the cooling rate from 0.15 to 0.2 degrees Celsius per minute up until to 38 degrees. Okay. So this is roughly for the diagram outside from the hospital. So that means when suspected victim arrive or come to us, and then we must bring the victim to the safe, cool and shady environment, check for the vital sign, provide the oxygen supplementation, okay, and then remove all the clothing, and then can start tepid sponging. If we have the tap water, then we can put the patient inside the tap water. Other than that, we can, if patient is conscious, we can provide for the water supplement. If patient is unconscious, then we can put inside for the IV drips, okay, and then refer to the nearest hospital or clinic. So in ED, usually they will triage for the heat stroke patient to the red zone, and then same for the trauma or acute patient, we must assess for the LBC, and then provide the definitive airway protection if necessary. So same way, remove all the clothing and then cover with the thin sheet. Use the iPad, put at the head, neck, and also axilla and also inguinal regions. do the tepid sponging regularly, try to avoid PCM also NSAIDs, and then can consider also for the lavage with the cold saline. During the patient in our ED, must do the close monitoring, check regularly temperature, blood pressure, and also the heart rate, and then GCS of the patient. Okay, while waiting for the other investigation to come back. Okay, I think that's all. Thank you.